welcome to Time for Health. I'm your host, Rachel Fall, and we're super happy that you're here. As always, we kind of bring a guest to you who's an expert in a certain area to share information that might be helpful for you or somebody you know and love. But always, before you do anything new or crazy or anything like that, always make sure you're talking to your doctor, your nurse practitioner, whatever, your healthcare professional to make sure everything's kosher for you. So today we have Michael Wilson with us. Thank you for being here.
Yep. Thank you for having me.
And we're talking about anxiety.
Yep.
Now, I'm sure nobody has a lot of it, but we thought we'd talk about it anyway.
Sure.
So, first of all, tell us a little bit about yourself.
Yeah, sure. Like I said, my name is Michael Wilson, and I'm a clinical therapist with an organization called Safe Haven. And we do in-home counseling, and we're here in the area.
Cool.
So, yeah.
All right. So, do you go to college to be a counselor?
Great question. Yeah. So you can, the path that I took actually is I have a bachelor's in psychology.
Okay.
And then I got my master's in clinical mental health counseling.
Okay.
And then after that, you have to do 700 hours of an internship somewhere. And then after that, you have to take a national counseling exam.
Licensure.
So So then you do the licensure, and then depending on which state you're in, you may have to do even more.
Okay.
So it just kind of varies.
So you've got the credentials,
I do have
you've
those
been doing this a little while. Okay. Yep. So anxiety, I think I know what anxiety is, but what really is anxiety?
Well, what do you think anxiety is first?
Things that stress you out, being stressed out and not being able to handle it.
Very much so, yeah. I'd say anxiety is our body's natural way to handle stress.
Okay.
So with that, there's good stress and there's bad stress. I think that's where people kind of maybe get off track a little bit.
Okay.
We call bad stress distress.
Okay.
And then we call good stress eustress.
Okay.
So there's distress and eustress. So eustress is that type of anxiety that motivates us. It's usually short term. We're able to sort of cope through it.
Okay.
And it can feel exciting. So maybe playing music in front of a group of people, or performing in a sport, or
taping a TV show.
Taping a TV show, exactly. Eustress improves your performance.
Okay.
So that's where that is. And then there's distress, which can kind of cause more of what we know as anxiety, and is more concerning. So it could be short term or long term. We have a hard time coping with anxiety.
Okay.
So it feels unpleasant, and obviously can decrease your performance.
Okay.
So,
things come at you, like you can't not have stress.
Right.
You know what I mean? Taxes, price of gas, whatever. So stress is always coming at you, but it kind of, eustress is sort of, it motivates you or you handle it well. Distress is when the same thing might come at you, but you're not handling it well.
Absolutely. It's different the level of stress is different for every person, depending on their age, what they've been through in life. All those things can impact how much stress we can handle.
Okay.
And it's sort of that give and take, kind of like through school, where we wouldn't ask a first grader to take an exam on all 50 states. That would be way too stressful for them.
Right.
But to write their name would probably be enough stress to challenge them to then keep going.
Gotcha.
So it's kind of that balance.
So there is good stress, there's bad stress. Okay.
Absolutely.
And it's different for different people, like you said. So after this many years, taping a TV show doesn't give me a whole lot of stress, but I've asked people in the past to be on it, and they just break out in hives. So the same stress is different for different people.
Very much so.
Okay.
Yeah.
What does it look like, and does it look different in a first grader, or somebody in middle age, or a senior?
Yeah. I think from a professional standpoint, we're looking for kind of like a cluster of different symptoms that would give us a better picture of what's going on with that person.
Okay.
So there's certain areas when we're talking about anxiety that I would be looking for in somebody. So it'd be, is this person excessively worrying too much? That would be outside. Do they seem agitated? Are they restless? Are they fatigued? muscle tensions,
Okay.
you know, those types of things, trouble falling asleep, maybe having a panic attack, you know, avoiding social situations, and then lastly, those irrational fears.
Okay.
You know, fears that are kind of outside the realm of what we would call typical.
Okay. So that is kind of similar for young people, middle-aged
Yep.
people, older people,
Yeah.
all those kinds of things.
Yeah, and you know, the way that we handle stress can change throughout our whole life. So I think anxiety is one of those areas where you could be fine all the way through till your senior year and then just have way too much on your plate to sort of handle. But don't worry, I think some stress is actually good.
Yeah, like you said, it's kind of motivating.
Absolutely, absolutely.
So kids might be anxious or have trouble sleeping. Do they go through, like if there's just a certain, like a test or something stressful is going on in their life, can it be short term?
Yeah, absolutely. And I think, like I said, that's more the difference between the eustress and the distress. Whereas eustress is short term. Like, obviously, after taping this today, I will feel so much better. Like, I don't think anything could happen through the rest of my day that would be as stressful as this.
Gotcha.
So it's more short term. Okay. Whereas for you, if you're doing all of these tapings, if you were just so panicky after every episode, that would be causing you distress,
Gotcha.
and not eustress. So.
And can people, can they live with that kind of stress? Does it start to impair how they function and that kind of stuff?
Yeah, absolutely. If you feel those symptoms that I kind of described earlier, and these are still going on, then that's where you can get into some of our anxiety and mood disorders. And those where you would definitely want to seek out help for.
Okay.
So we've got generalized anxiety disorder. So this is
Okay.
the one for all of those symptoms that I had described. You're hitting all of them. There's social anxiety disorder. There's specific phobias, so irrational fears, and panic disorder.
Okay.
So and unfortunately, one of the number one reasons why people go to the emergency room, I've heard, is because of a panic attack. Actually, you start having the heart things going on, and exactly.
Okay.
So it's. I think people might be a little bit embarrassed when they go, but that's okay. That's why you did go to the right place. It's just you need to kind of maybe follow up with someone more in my field.
Okay. So I'm kind of looking at your
No,
list
yeah,
over
absolutely.
there of the symptoms that they can be short term. They might come and go. Some people can handle it a little better than others. So
Yep.
I would imagine some level of awareness of yourself is important.
It's extremely important. I think that's what you know yourself. What nervousness feels like. You know, I think that the more you kind of get in tune with that and can develop better coping skills, that could definitely relieve some of that anxiety. I think again, like with stress, you're just more relieving it, and coping through it than you are just extincting it, because that wouldn't really be worth doing anything with.
Right, because stress is always going to come at you. The alarm
Absolutely.
clock goes off every morning, and that is a form of stress.
Yeah.
Sometimes motivating, sometimes not.
Depending on what kind of day you have. So yeah, I mean, gaining awareness towards how anxiety feels and when you experience it is a good thing, and I think you sort of grow into that. So, I would say that one of the hardest thing I've done today is to take that national exam to become a counselor. And before that, it was getting married, and then before that, it was graduating high school. And so, as you go through life, you will hit more stressful milestones.
Okay.
That's why old people are so calm.
They've seen so much, they're like, just chill out,
Yeah,
relax,
exactly.
stop. So when you were talking about the signs and symptoms earlier, and they're all kind of, they look, or there's the same symptoms sort of for young and old. One of the ones you talked about was like fatigue and sleep issues, excessive worrying. Are there people who just have sleep issues, or people that have maybe a better symptom to is excessive worrying? Are there people
Yeah.
who just worry, but it is who they are? And
Yeah, and it's not really. I guess the biggest thing to remember about anxiety is how is it impacting the person's life? Like, is it? Do you have so much anxiety that you can't wake up and go to school the next day? You know,
okay.
do you have so much irritability that you're just getting in trouble all the time with your teachers and your parents? You know, so
Gotcha, yeah.
it's more of like a spectrum of those symptoms.
okay, so
So,
I'm just thinking of excessive worrying, like, and you talked about this, I think, about like an obsessive compulsive thing, that it
Yep.
can turn into that, like, okay, people use hand sanitizer 4,000 times a day.
Yeah.
Well,
Maybe
they
just want to be
use their
clean.
hand sanitizer 4,000 times
Absolutely.
a day, and it's all good.
Yeah, yeah. I would say that, you know, when you're talking about mental wellness, I think that it's all about how it impacts the person's life. You know,
Right, okay.
so we all have a little bit of these symptoms. You know, we're all
Sure.
we're all a little nervous about germs and maybe use over sanitizing
Right.
a little bit too much, which is good. So
Right.
now if you can't open up the door to your house because you're afraid that it's dirty, then that would be more of a thing you would want to
Gotcha.
work on.
And you talked about kind of what it does to a person long term is in terms of some of those
Yeah.
diagnoses that you talked about. And I was kind of, trying to remember
Yep.
what they are and everything, but it's not really up to us lay people necessarily to remember. Well, I
Yeah.
think what I have is
please
a
don't.
phobia of some sort.
Yeah.
It's just when it starts to get to the point where it's really impacting, then you
Absolutely.
kind of seek a
You wanna
professional's
seek a
help.
professional. Absolutely, you know, and when it comes to mental health diagnosing, it really depends on lots of different variables. When you go to a medical health professional and they check your heart rate and they determine that you have high blood pressure, then that's pretty cut and dry, you know. But
Right.
in my world, it's all of these other kind of symptoms where, the person's background might be a factor, the person's age might be a factor, what they've been exposed to, how severe are they worrying,
Okay.
and how is that impacting them. So the cool thing that I like about mental health is that nothing is as cut and dry. So it's much of like a spectrum.
Lots of pieces, parts.
Lots of
this
pieces and
kind of-
parts,
okay.
and I consider myself someone that's more kind of organized-ish. So I
Right.
get called OCD, obsessive compulsive
Yeah.
disorder, a lot, and that's just not true. It's what
Right.
I think people that maybe are a little bit more messier than what I am would probably label that. So
Gotcha.
you have to be careful with that.
Okay, awesome. Thank you
Yeah.
very much.
No, absolutely.
We are going to take a very quick break, and we will be right back to learn more about anxiety. And we're back. We're learning about anxiety with Mr. Wilson. Couldn't resist.
I know.
I know. So we're talking about anxiety specifically, but I think depression is also a mental health concern for some people. And I don't know that they're used interchangeably because I think they're different. I guess
Yeah.
explain how they're different.
Sure. So they're different in the cluster of symptoms that they present. It's kind of a broad way of putting it. But
Okay.
I think with depression, we tend to think more of moments of sadness, whereas anxiety is more feeling overwhelmed. So
Okay.
those are kind of the two. But it's interesting you say that because research shows that 50% of people with anxiety also have depression. So you could have coexisting disorders kind of happening at the same time.
Gotcha.
So-
And could they, because I'm thinking worry or irritability or sleep issues could also maybe be signs of depression.
Yeah, yeah.
And again, that's why we don't diagnose. You
Right,
do.
right, yeah, and it and you could be, like a scenario I could think of is, someone is so anxious and suffers from so much social anxiety that they can't go to school. Okay, and then if you don't go to school, then you're not going to learn anything. You're not going to have, peer friendships. You're not going to get sunshine, and you're not going to get out. So then you're going to feel depressed, and it's
Gotcha.
just so you could be depressed because you have anxiety and sort of fall into that
Gotcha.
that trap
A
hole.
kind of a vicious cycle,
Yeah,
sort of.
yeah, absolutely. So I think, they both are very closely interchangeable. It's just, depending on who your clinician is, how they're gonna
Right.
they're gonna treat
And
that.
overall, the depression is more of the sadness,
Correct.
and anxiety is more of the overwhelmed.
Feeling like overwhelmed. Yeah,
Okay.
I'd say that'd be probably the two biggest
Generalization,
Yep.
but that's kind of how they differ. Awesome.
Yeah.
So, honestly, I mean, like I said in the very beginning, everybody has probably some anxiety. We certainly have stress. You can't
Yep.
be alive and not have stress. But how can a layperson
Sure.
help either somebody that they know has anxiety, or they're kind of watching them and thinking,
Yeah.
I think we might be developing something. How can we help?
Absolutely.
What do we look
So
for?
I've got a couple of tips on what someone can do, then I'll kind of back them up with things that you should not do.
Okay,
also.
perfect,
Because
yeah.
those are things that kind of,
Yeah.
it's kind of like a gray area, but the most important thing you could do is to be available to that person. But what you don't want to do is to overcrowd that person and make sure that they're going to be okay,
Like
and
smother them.
smother them or
Don't do
whatever,
that.
because that never feels
No,
good.
that doesn't work for anybody.
And it's sort of, it makes you think of like, like when your child gets hurt and your mom's always like, are you okay? Are you okay? Are you okay? Are you okay? And when they say that, you start to not feel okay.
Right.
So I think
Okay.
being available to that person is most important.
Being physically available,
Physically.
listening to them,
Yep.
just all of it.
Just
the whole-
just being here like this,
Okay.
And sometimes being silent is honestly the best way to be there for somebody. So.
That is often a gift, isn't it?
Yeah.
Silence.
Yeah.
Just sitting in silence with somebody.
Yeah.
Okay.
I'd say another one would be patient,
Okay.
for that person, kind of, because a lot of the times I think anxiety symptoms are short term.
Okay. Right.
So you can just sort of, be patient and give that person the time to sort of get their bearings straight. And you won't know when that time is if you're there to help that person. So definitely don't say, hurry up, can
Is
you
your
get over this
anxiety
pain?
over yet?
Yeah, we need to get this moving. That's never a good thing to do.
And, well, that situation was in the past.
Yeah.
Get over it. Move on.
Right. No,
Nah,
it's
it
because
doesn't work that way.
it doesn't, and you don't know what's mental health symptoms are usually on the inside of us. Whether or not you could tell that I'm anxious today or not is irrelevant.
Right.
It's for me to feel. Which I think then my third one would be to empathize, not patronize
Okay.
somebody. To make sure that you're not, say something like, well, here we go again. We're going to be all anxious and ruin our time out today. That's never good. It's not going
Yeah.
to help that person get over that.
So and
So.
like empathize and sympathize.
Oh,
I
boy.
heard somebody say like
Sure.
empathy is standing alongside that person, or
Mm-hmm.
but what you don't want to do is like if they've fallen in a hole, don't jump in the hole with them, kind of a
Correct.
thing.
Yeah.
Don't get anxious yourself
Don't
or
get anxious
wallow
yourself.
or anything like that.
Yeah, it's more about being just a firm rock for that person to be supportive on, and to know that you're just available to them. Probably the
Gotcha.
best thing.
Okay.
Make sure you have support for them continuously through that.
Okay.
Check in with them later on.
How is there? There probably isn't really a guideline. How often would
Yeah.
you check in on somebody? I mean, I guess it depends on
Yeah.
the relationship. If they live in your house, you just,
Yep.
a lot easier.
And you as a friend or as a family member, you'll start to understand more about what those triggers are that sort of cause them to go into this panic state more.
Okay.
If I hear that exams are going on here soon, or maybe now, and so that would be a time when it would probably induce maybe some more stress for people.
Sure.
That would maybe be a little bit outside the normal realm. So
Okay.
just to be supportive to them. And if you think that you're going a little bit over to the other end, to just seek a professional,
yeah. Talk a little bit about stigma, because
Yeah.
when you have a broken ankle or an ear infection or whatever,
Yeah.
it's so easy to seek help.
Right.
But when you have these things that like you said, I'm feeling it inside. Whether
Right.
you can see it on my outside is irrelevant. But people, it has a stigma sometimes.
It most definitely has a stigma, I think. And from my point of view, being the professional, it's really difficult to deal with that side. That's one of the reasons why I like to get out and sort of do these types of things, because mental illness, and I hate using that word. I like to use mental wellness most of the time, but you know, mental illness impacts 1 in 4 people. So there's a handful of people here today in the studio. Odds are one of us is going through something.
Right.
So there's a lot of stigmas around that.
Yeah.
You know.
But there are, you know, there are lots of providers. There's lots
Yeah.
of help available.
Yep.
A person doesn't have to dig too far
Right.
to find. So that's a great thing.
Yeah, there's tons of support. I just think it's hard sometimes to walk through the door.
Take that
you know,
first
take
step.
that first step. So which is why, you know, one of the things that I'm doing and with my agency is, you know, we're actually going into the homes to sort of help out to relieve some of that stigma.
Sure.
So we actually come to you.
Yeah, and in a small community, I'm
Yep.
sure maybe stigma or concern about that can be even harder sometimes.
Yeah.
So, yeah, that's very cool. So we talked about symptoms and what
Yep.
it looks like and what it isn't and kind of what to look out for and how to help people. But what about trying to maybe prevent anxiety? You know, stress
Yeah.
is always coming,
Right.
but how can we prevent that stress from shoving us into
Yeah.
full anxiety?
Yeah. So I think there's a couple of things that that we can do as the person that's experiencing the stress. You know, I think becoming aware of, you know, what it feels like. You know, like I got up a little bit extra early this morning just to kind of bring my own nerves down today, and secondly to not scare yourself.
Gotcha. Okay.
You know, because if you've ever been anxious or nervous, like I think this is what it feels like. Like you in your head are like, you know, oh my gosh, I'm gonna fail, I'm gonna fail, I'm gonna fail, oh my gosh, I'm gonna fail, I'm gonna fail.
You just repeat it.
You just repeat it in yourself, which is called ruminating.
Yeah.
Cows do that with grass, and we do that with our thoughts. We just continuously will say that, and that's gonna scare yourself into a panic attack.
Gotcha.
You know, calm down, take those deep breaths. They call, you know, some of these coping skills I think are a little bit cheesy, but they do
But
work.
if they work,
they absolutely
you can call it
work.
whatever you
know?
want.
And from a therapist, I'm continuously saying, you know, to take a deep breath, count yourself down from 10. You know, listen to music, but those are all self-calming things.
Right.
that
They're
we
kind
do.
of like the pattern interrupt that you need. Like,
Absolutely. Yep.
Hold it.
Yeah, and you can.
Breathe. And the easiest one is to breathe.
The easiest one is to breathe, and it's also the less noticeable because if we're having an anxious moment, it doesn't look very cool, you know.
Right.
But if you can just take some deep breaths and sort of get yourself centered, you know, relax your body, I think is most important. One of the biggest signs of anxiety is body tension. You know,
Okay.
you can feel it. Your muscles, your jaw will tense
Yeah.
up, and you just kind of
Shoulders.
feel that tenseness. So try to distract yourself, whether it be with a fidget spinner or something, you know, and keep your stress levels in check would probably be the last thing I would
Okay.
say somebody could do.
And unfortunately, I think why one of the reasons that this topic is so important is because sometimes when we're not armed with these tools of how to calm ourselves down,
Yeah.
we turn to things that only make life worse.
Yes, very much so.
Being mean,
yeah.
substances of all sorts.
Yep.
All that good stuff, and that's not good.
No, we that would be you know, ways of self-medicating in a very, very unhealthy way, and a lot of that substance use stuff, believe it or not, I mean, it counteracts anxiety. It makes it worse because after we you know, are having like a bad moment, and then we do something like that, and then we just feel even worse about
afterwards, and that's a vicious
Correct.
negative cycle.
It's very, very negative. So I think, you know, I think if anyone takes away anything today, it's to know that, you know, eustress is a good thing, and feeling stressful is not always a bad thing.
Right.
You know, because I think a lot of times people will maybe self-diagnose themselves with having a anxiety, you know, issue, and really it's just part of life and going through that. You know?
Or they might need they might be doing that repeating thing in your head, like I'm gonna fail, I'm not good at this or whatever, and we just need that pattern interrupt. Those tools that you gave us.
Absolutely.
Any last thoughts before we end our show? Anything we missed, or anything you just really wish people would know? Or
About anxiety, if you feel as if you're kind of presenting those anxious symptoms to the point to where it is impacting your life, to feel free to reach out to somebody. We do have tools and things that we can do short term to sort of alleviate that, so you can hit those milestones. Because what we don't want to happen is that someone's anxiousness is to the point to where they're not able to graduate from school and to go off and to do those things. So
awesome.
Yeah.
Very cool. Thank you so much.
That's what we're here for.
All right.
Thanks.
All right, we're going to take another break, and we'll be back.
All right.
And we're back. I want to thank Michael for being our guest today, talking about anxiety. It is prevalent. 1 in 4 individuals is probably dealing with some kind of anxiety issue. With all the stress in the world, that is no surprise. He gave us some great tips to look out for, some things to help ourselves and others, some great tools to use to kind of do a pattern interrupt when we're heading that direction. We're also going to list some resources, some phone numbers on the screen in case anybody would like to talk to somebody further about that. So just such an important topic, because again, it can lead down a very rough path if the coping skills that we use are not the best coping skills. So thank you again. And if you ever have suggestions about an episode for a show, you can reach me at Magruder Hospital, and I just thank you for being here today. And as always, I ask you, please make time for health.